Welcome to today's episode of the Medical Fitness Podcast, powered by the Medical Fitness Association and the Medicine Rehab Fitness Institute. My name is David Flench, President and CEO of the Medical Fitness Association. I'm co-hosting this episode with Jeff Young, the co-founder of the MRF Institute and an adjunct lecturer at the City University of New York, York College. Hi, Jeff.
Hey, David, and hey, everyone. We are excited to have Greg Mihailovich on our show today. Greg serves as a national advocacy consultant for the American Heart Association. Greg, it's great to have you on the show and excited for our conversation.
Hey, Jeff and David, great to be here.
Let's kick it off, Greg, just with a general question where you maybe just tell us about your work with the American Heart Association.
Well, sure, happy to. American Heart Association. So, heart disease is the number one killer worldwide, and stroke ranks second globally. So, even when those conditions don't result in death, they cause disability and diminished quality of life. So, the Heart Association wants to see a world free of cardiovascular disease and stroke. So, over our 100-year history, we've been striving to save and improve lives by funding scientific research that's led to life-changing breakthroughs in cardiovascular medicine. But in addition to the treatment, we also advocate for preventative measures because we want as many people as possible to learn what they can do to prevent heart disease and stroke. So we have what we call Life's Essential Eight, which are key measures for improving and maintaining cardiovascular health. And anyone who's thinks about health, it's some pretty obvious stuff. It's like eating better, being more active, quitting tobacco, getting more sleep, managing your weight, managing your cholesterol, blood sugar, and blood pressure. So I'm part of our advocacy team, and what we do is we work on the federal, state, and local levels to pass policy, system, and environmental changes that can help everyone achieve these essential eight measures and live their healthier lives. You think of it like we try and level the playing field, so everyone has an opportunity to eat healthier, to be more active, and have access to quality medical care. And so, for me personally, I'm a consultant for our active living policy portfolio, and I support our campaigns that focus on helping people to be more physically active. So, yeah,
Yeah, okay. Well, I'm gonna chime in with a question, and I'll let the audience know right from the beginning because we'll be diving a little deeper into this in a little bit. But I met Greg through a previous guest, Dr. Laurie Witzel, and I direct the New York State Physical Activity Coalition, and Greg, I've actually been uh, riding his coattails a little bit and his expertise and helping me, get this thing going. Um, and so, with that as a little bit of a background, you mentioned with what you just said about being more active, and you and I are obviously talking about that in our meetings related to New York Moves Coalition. So, what does the American Heart Association do to advocate for increased physical activity?
oh, well, a lot actually. Like the benefits of physical activity have been apparent for decades, but the association realized that we needed to do more than just tell people to get more exercise because it's not that simple. So in the early 90s, we published a strategic plan that contained a series of recommendations for health professionals, parents, schools, even in the insurance industry on how they could promote increased physical activity across the US population. And we helped form the National Coalition for Promoting Physical Activity. And the coalition created a network of state physical activity coalitions, which promoted physical activity through community action and media advocacy. And in 2010, we were part of a larger effort led by Russ Pate at the University of South Carolina to develop the National Physical Activity Plan, which is a comprehensive set of policies, programs, and initiatives designed to increase physical activity in all segments of the US population. The plan aims to foster a national culture that supports physically active lifestyles and allows everyone to realize the recommendations made in the physical activity guidelines for Americans, which we know, but everyone knows it's like 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity for adults and 60 minutes combination of moderate to vigorous activity for kids 16 to 17. So how can everyone get those minutes of physical activity? Um, in 2019, the Coalition for Promoting Physical Activity, the National Physical Activity Plan Alliance, and the National Physical Activity Society all merged to form a new organization called the Physical Activity Alliance, which the American Heart Association is a leading voice and provides backbone administrative and strategic support. So the Physical Activity Alliance is the nation's largest coalition dedicated to advancing regular participation in physical activity, and we use our collective voice to lead efforts that create, support, and advocate for the policy and system changes necessary to empower people to enjoy physically active lives. So, we're leading the movement to make physical activity more accessible, frequent, and integrated into day-to-day lives and health of all people.
Love
Thanks,
it.
Greg. MFA has partnered with the Physical Activity Alliance for a while, and love what it's doing, and love seeing some of these statewide initiatives like New York Moves that Jeff is leading and you're part of. Um, and and you mentioned some of the things that American Heart Association is involved with related to the PAA. Can you get maybe just a little more specific on some of the efforts of the collaboration that is happening between American Heart Association and the Physical Activity Alliance right now?
Yeah, well, like I said, we provide, that kind of like administrative and strategic support for the work that PAA is doing. And they're working on a lot of different, like they have their It's Time to Move campaign, which is a multi-year project that empowers healthcare providers to seamlessly integrate physical activity clinical measures into patient care plans and help make physical activity prescriptions a standard of care. Like we're seeing a big rise of like food as medicine, where you could prescribe healthy food, the idea that healthcare providers could prescribe physical activity to help treat some of these things. So that is a multi-year campaign. There's also the CEO Pledge for Physical Activity, which is a nationwide campaign inspiring leaders to adopt movement-friendly strategies that enhance employee health and productivity. And those are like little things like creating environments that are supportive of physical activity, like allowing people to schedule, physical activity breaks, walking meetings, having a room set aside where people can stretch or yoga, like the little things like that, which really help productivity and keep your spirits up during the day, like get that physical activity. And these are all in support of something that's a big part of what we do is Active People Healthy Nation, which is a national initiative led by the CDC to help 27 million Americans become more physically active by 2027. So that's where we want communities to implement evidence-based strategies to increase physical activity across sectors and settings to improve health and quality of life. Um, and because we have these local champions, we support the development of these state physical activity plans, like we're trying to do in New York, like they've done successfully in Michigan, like they've done in West Virginia. The idea that the National Physical Activity Plan is a broad-based document, like the idea, how do you winnow it down and meet the needs of the people in the state? So that's one thing that we're doing. We're supporting this work on a local level, uh, so that we can meet people's needs and everyone can be more physically active.
Well, that is an absolutely perfect lead into what I wanted to ask you. Um, because selfishly, I want to know, New York State and just launched this 5.5 months ago. We've been working on it. So, regarding what you just said, what challenges are there in creating physical activity plan for the state of New York?
Well, New York is a big state, both geographically and population-wise. So the plan can't be one size fits all. Like some of the smaller states, they're a little more homogenized, a little more same. But we have a lot of different sectors in New York State. We have a lot of different regions. I mean, there's like 10 different regions in New York, and the needs of someone, the barriers to physical activity that someone in Brownsville, Brooklyn is different than what someone's in the southern tier in Binghamton. It's just different from someone in Plattsburgh versus not, like everyone has different needs and different barriers. So the idea is if we want the plan to be effective, we need to have as many different voices in the discussion, and we have to really listen to what these barriers are, the barriers that people are facing, or that are discouraging or even preventing them from being more physically active. And we want to recommend the best evidence-supported solutions to overcoming these barriers. And if people feel seen and heard during the process of us drafting the New York State Physical Activity Plan, they're more likely to embrace the plan. And because it would be theirs, they would feel like they would have ownership, and they'd be like, "This is something that's going to help us all be physically active and live healthier lives." So, Yeah, no, it's New York. New York is a challenge sometimes like that when you want to do statewide policy.
Yeah, yeah, this is great, and we've talked about it before, but just as an FYI, I don't know if you had the opportunity to hear it yet, but last week on Mike Stack, and for the listeners here, Mike Stack is the current president of the PAA, and he's launched and is directing Michigan Moves Coalition, and he has a podcast, the Wellness Paradox podcast. And last week, the topic was state level implementation. And I'm not, here I am hosting a podcast. As embarrassed I am as maybe to say it, I'm not the biggest podcast listener, but I definitely listened to that one because I wanted to hear what he had to say. And interestingly, and actually good for me, I would say 90 to 95% of what he said on that podcast, he told me directly one on one. So it kind of made me like, oh, okay, good. Because what you said to me individually, you're now putting out to the world. It's not these two different things. So that was really helpful. And a colleague of mine, her name's Melissa, who lives in Florida, we recently had a conversation about something else, but she's potentially interested in launching a state level coalition in Florida. And she was asking me about what's my advice to her? And, one of the things I said was, look, I'm only 6 months into this, but one thing I can tell is that I have gotten myself into something. And, and I said, I go through kind of like this ebb and flow where sometimes I'm really excited about it. And then sometimes I'm like, dude, what'd you just do, etc. And one of the things I said to her was, you before you do this, think about as the coalition grows, the more it's going to affect, your personal life, your professional life, your the bandwidth you have in your life to do this. And that's something that I probably didn't think enough about early on, but it was part of the advice that I gave to her. And as it relates to what you just said, we also did talk about the fact that you have to modify it for the state, and that you spoke with me in the past about literally what you just said, how Northern New York and Western New York and New York City, are going to have different ways that you're going to need to modify this. So in any case, this is interesting insight for me because it gives me a little flash into the future on the things I'm going to the challenges I'm going to face as I move forward with this, and why I'm going to continue to ride your coattails here for a little bit. But in any case, you mentioned the importance of local voices in shaping a New York specific physical activity plan. So I'm curious how the New York Moves Coalition can ensure that underrepresented or the marginalized communities have a seat at the table during these discussions.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association, helping fitness professionals and medically integrated fitness centers achieve their full potential through education, certification, and networking opportunities. Join today and elevate your career with the Medical Fitness Association. Visit medicalfitness.org to learn about the many benefits of membership offered by the Medical Fitness Association. That's medicalfitness.org.
Well, I mean, I think the you know the broad way of approaching it is that the coalition needs to be a big tent. Like they talk about this. The idea is like open to as many people as possible because there are so many different societal sectors that New York needs to consider with the physical activity plan. I mean, you have business and industry, you have community recreation, fitness and parks, education, faith-based settings, healthcare, media, military, sport, transportation, community design, like all these things that you have to consider. And the thing you have to be very very proactive on is not letting the bigger, stronger, better funded sectors drown out the other members of the community,
Yeah.
especially if what you're hearing is what you want to hear. You know what I'm saying? Like sometimes
Yeah.
that's a self-fulfilling. You're like, this is where we want to go. Yes, 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 this is where we want to go. And you kind of start missing what the little people. So if everything starts looking like a little bit of an echo chamber, even if it's exactly what you were hoping to hear, you have to be deliberate about seeking out that feedback from different groups, looking at the groups that we have and saying like, oh, you know what, we're pretty downstate heavy. We don't have anyone from the North Country. We got to really kind of work to find someone out there. Like let's let's get a voice from that thing. We have a lot of people from healthcare or from the fitness industry. Okay, what sectors are we missing? And we have to chase them down. And that way you're ensuring that it's going to be the broadest, biggest tent possible. And you're getting the most, like, you're never going to reach 100% of the people, but you make the best effort you can to get as many people under the big tent as possible.
This is really helpful for me. It really is because, again, I'm 5.5, 6 months into this, but it's such a fast learning experience. It's, you and I haven't spoken in a few weeks, but just know that I've been having a bunch of meetings with the stakeholders that are sitting at the table now, and it forces you to learn fast. But hearing you, even though we've talked about this before, hearing you say it again is really helpful. And again, I'm able to. First, I didn't know what I was getting myself into, and now I can start to see the picture. Look, not anywhere nearly as clear as you do because you've been doing this for quite some time, but without a doubt, there's definitely more clarity that's going on. So this is really helpful.
And I think what one thing that's really interesting is how the PAA and the National Physical Activity Plan, at a national level, they probably have even more of those challenges from a diversity and representation standpoint, and so that's why I think the state initiatives are so important. But I would even go further to say once some state initiatives are set up and have some good momentum, that we could even drill down further to local areas, regional within a state, to give even more personalization or customization of these plans at a local level. What are your thoughts on that, Greg?
I think that's a great idea. I mean, there's a phrase that a lot of people use. We use it at the American Heart Association. Is you try to meet people where they are. The idea is just like we're meeting them and to meet their needs. So especially put another thing on Jeff's plate, the idea of like building in space into the New York plan where there is an opportunity to flesh out a regional section of it. Like there is this, it's not like the plan is here's the plan and we're done and high five. And it's like, no, this is just a blueprint. And it's like, where can this evolve? Where can this grow? And leaving that space where if there is a really vibrant participation in Western New York, in the Southern tier, that they go, you know what, we have ideas which work for us. Like, how do you incorporate it in the plan? So I think that's a great idea. Um, you just got to give them the space to do that.
Um, Another question from your experience, what role do you think the healthcare sector plays in reinforcing community level efforts to promote physical activity, particularly through these partnerships with organizations like the New York State Moves Physical Activity Coalition?
Well, the healthcare sector plays a crucial role by providing that kind of advice and promoting healthy behaviors and facilitating access to resources. Like that's that kind of supposed to be that trusted voice in the room. The idea of like your healthcare professional saying, "Hey, you know what? This is something that you really need to do that. And here are the resources. Here's the best process going forward." Assessing their physical activity needs, offering personalized recommendations, and connecting them with those community resources are really a huge part of it. And that kind of goes hand in hand with the New York Moves Coalition because the idea is that lends a certain amount of credibility. The idea that the healthcare professional is like, no, no, this is a plan that as a healthcare professional, we want you to be aware of and support, and like all that stuff. So there's a kind of a trusted credibility that really underscores the work that the New York Moves Coalition is trying to do.
Yeah. I love all this work. I think it really seems like the PAA and American Heart Association are working on this systems level change. And I tell you, the MFA is also a big advocate for that type of work. Can you think of maybe a good example of a policy or systems change that's had a real measurable impact on physical activity levels in a state or community? And then the second part of that question, if you have an example, then how might that model inform what's done through the efforts of the New York Moves Coalition?
Well, yeah, I mean, I have a great example. So, New York City, about 6-ish years ago, passed a law requiring the New York City Department of Education to report on all aspects of physical education in their schools. The time the kids were getting, the space they were using, the personnel, what the curriculum was. Not changing anything, just you have to tell us what you're doing and keep a record of all that stuff. And when they were able to see where the friction points were, which schools were struggling, this school doesn't have physical activity space. They're doing, the physical activity is them doing jumping jacks in the classroom and they don't have any more going on. It really gave the Department of Education a clear view on where they needed to put the resources. And it really empowered parents and schools and advocates to develop targeted solutions to improve access to quality physical education. And what they started doing is they were like, okay, we need to put more funding in to hire certified PE teachers. Okay, we need to have more capital funding to make sure this school and this school and this school have safe and accessible and appropriate physical activity space. And the numbers in 5-6 years, and this is also including through the pandemic, because they were using these resources to think about like remote physical activity and how they could do that when people were home. The number of physical activity and the quality of physical activity has just skyrocketed. It really is a success case. So for something with New York Moves, the idea is like you don't necessarily have to change anything. Sometimes it's just finding the data where you can see where the friction points are and being like, oh, you know what? You shine a light on it, and everyone goes, well, we can fix that. Like, how do we do that? Let's put some resources over there. Like that's a huge part of it, is knowing where the challenges are. That's part of, the different stakeholders that's, doing this stuff. So are there system changes where it becomes more apparent where the inequities lie? And that's the first step. And then the next step is, how do we fix it? So, I mean, I think that's a good thing to keep in mind, that you don't have to, you don't have to build Rome in a day. Is that, you don't have to do it in a day, but you should probably know where you want to build or what you want to build. And like, that's the whole thing of the plan. And the big home run swings come later, once you know where the friction points are. But then, once you're building it, I mean, we talk about policy and system change, and then there's like environmental changes. The idea that you give people an opportunity to be physically active and they're going to take advantage of it. Again, in New York City, again, not to go in the New York City like bubble, because it's like whatever, but you have the Hudson River Greenway, which is like 12 miles along the west side of Manhattan. There was a lot of pushback about building it. Now they built this greenway. It's the most used bike path in the United States. Thousands of riders a day. Now they built the Empire State Trail, where they connected the greenway. You could actually ride a bike from the southern tip of Manhattan to Montreal or to Buffalo. There are like paths, and people use it. When you build it, you build a community center, you build a running trail, you build this stuff. You give people the opportunity where they can be physically active and feel safe doing so, and they do it. So the idea of like, but what are you going to build? What do you need? Like that's again, what do people need? There's a group in Brooklyn called We Run Brownsville, and Brownsville is the section of Brooklyn where it's like per capita the most public housing. They had no physical activity, and this group of women decided they were going to do We Run Brownsville, and they were going to do a running group, and they didn't have anywhere to run. They were like, we're going to find a path, we're going to find sidewalks that aren't doing, and we're going to run as a group. And eventually the city was like, all right, let's build a running track. Let's give them some resources, because they were shining a light on it. So the idea of like going back to the voices, tell us where the inequities are. What do we need to fix? What is stopping you from going for a walk? Like not everything has to be like, people think physical activity and they feel like they got to do, I don't know, spin class for like 6 hours or something.
Right.
Like, no, the idea is like, can you, if you have an opportunity to go for a walk, can you do it safely? Like that's all, you do that stuff. So there are so many little policy and system environmental changes that, while I don't think the New York Moves Coalition can necessarily facilitate those changes themselves, you can shine a light on it and draw attention
Yeah.
to it. And now people who are interested will push resources to it. And that's how you get that sustainable change.
Hey, as since we live in New York City, and I haven't been to the Greenway yet, and so have you used it? And I live on the other, I live on the east side, next, right by the East River.
Yeah.
So what would be the best entry point for me?
Ha- I mean, the plan, or again, when we talk system, the Manhattan, what they want to do is they want to connect the Greenway to do a complete loop around the Isle of Manhattan.
Okay.
But again, the idea is some of the gaps in the Greenway are in in Harlem and the northern side of the thing. It's shockingly, it's like the lower, the Upper East Side and the Upper West Side have gorgeous
Yeah.
greenways, and you go to some of the less income, lower income communities, and not so much. So the New York City's trying to build that stuff, but they do have a comprehensive bike map where you can find the thing, and you can go south and loop around the southern tip of Manhattan if you want. But I use it all the time. My son is
Okay.
10. My son is 10, and he's
Okay.
super jazzed to do it. And when he's like, "Let's bike on the Greenway." I'm like, "All right, let's bike on the Greenway." Like sometimes you don't have time to like. I just want to relax. It's like keeps you young, keeps me physically active.
Good. I love it.
Yeah.
Yeah,
And
Miguel,
hey,
since we're talking about the 2026 event for MFA, the
yeah,
Northeast regional event being right there in Manhattan, maybe we need to make you said it's the Greenway, is that what it's called?
yeah,
Yeah.
The Greenway part of the event somehow. We get,
yeah,
everybody out and moving on it. That sounds awesome.
absolutely. We really should speak with Amanda about this
Absolutely.
and figure something out. That'd be awesome.
Yeah.
Okay. I'm I was excited going into this meeting and or not this meeting, this show. And because again, selfishly, this is really helping me out a lot, man. So I appreciate all your advice here and this conversation. I have one more question for you. Again, selfishly regarding the New York Moves Coalition. Looking ahead, how do you see New York Moves evolving over the next 2 to 3 years? And what role do you think the American Heart Association will play in helping to scale its efforts nationwide? Because that's part of the way I look at it is I want, I know there's Michigan Moves and there's a couple other ones, but I want to be one of the pilots, or I want New York to be one of the pilots to help scale this. So I'm very curious your thoughts.
Well, I mean, we're only a couple of months into it, so it's you got to crawl before you can walk, and you got to
Yeah.
walk before you can run. And I know it can be frustrating, but I feel like that it's almost like a little bit of a starts off as a little bit of like a promotional tour when there's a new movie or show, like introducing yourself, introducing to the players, giving some background on what it is, and becoming that trusted voice. People are starting to be familiar. You want these multiple touches where people are like, all right, the New York Moves Coalition, right, right, right,
Yeah.
giving opportunity where it feels like that they're you're getting the feedback from them and they're seeing that stuff. I mean, again, this is the type of thing where it's hard to say that we should do XYZ at this point. Like the idea of like introducing ourselves to the communities, maybe that means it's a road show and you're doing mini symposiums in different regions. If there's a interested partner in Syracuse or whatever, it's like, okay, let's go do a thing in Syracuse and let's start talking to people. Let's start widening that tent so more people can do in there. And then as we're building this up and we're collecting all this information, like solidifying as an organization, the idea of, is there funding opportunities? Because nothing is free, the idea of like looking for grant funding, looking for if there's anyone who's looking to support the work, and started building this out as an organization, finding existing people to be aboard and building this out where, again, I don't want to put a timeline and give you agita over it where I'm like 18 months or whatever. But the point is when we build that foundation and we're ready to run, like we're in good shape. So I think it's learn by doing, right? And then spread your wings and go. Like I think that's what it is. But I feel like in the next year-ish,
Yep. Yep.
the idea of as many people in the physical activity space as possible in New York,
Yep.
hearing the name, having some touch point, something where it's like when it gets real, people are like, all right, those guys again.
Yeah. Again,
And that'll set up for success. That gives you that credibility, it gives you that familiarity where people are more likely to listen to what you have to say because you've been listening to what they have to say for the past year.
yeah.
Yeah.
This is all, seriously, this is all great stuff. Very helpful. Even when it comes to like symposiums and stuff like that, David, I'll probably be you're a master with things like that. So likely be tapping into you and the MFA and figuring out how we can set
Well,
things like that up?
What's great on this point, an organization like the American Heart Association with such good reputation and resources, MFA is supporting this as well. I think as some other groups continue to support these statewide measures. I mean, we already have, like we mentioned before, Mike Stack in Michigan leading this effort. Jeff, in a year from now, you're going to be referred to the same way, and people are going to be calling you and saying, how do we start it in Indiana, where I live? How do we start it down in Florida, like you were talking about, a colleague of yours? And so that's what's really great. I think we get some early wins from a few states. We figure out how to best support these and connect people, because I think that's a big part of it, is connecting people who want to be part of this movement. And so that's a big place where I think MFA and our members can really support these types of things. And like you said, we need to shine a light on it in a variety of settings. MFA has our regional event, our annual event. I think the annual could be a great opportunity to maybe have a panel sit down and those who are interested. Maybe we have some listeners in this podcast episode who say, man, I'd love to do that in my state. And so we have some opportunities for them to hear about what's going on in other states in a variety of ways. I think those are just some of the things that I'm thinking can come out of this that really start building off of that momentum too.
I mean, the cool thing is if you have the proof of concept for more community-based thing, like it is wreckable and scalable. I mean, Mike Stack, we talk about, Mission Moves. I mean, Michael is like a force of nature. Like you can't like
Right.
all we need is another Michael Stack in our state. Like I don't know, like easier said than done. And the West Virginia effort was led by, it was really led by, I think it was a university that started it. It was like more of an academic space. And if New York can build a model of like community facing community input, man, that could take off. So the idea is like building that right, building that foundation right, and people go, wow, this is something where it's meeting us where we are. I'm being heard, and we're seeing some real benefits by following this. Like it could really be something.
This is great. Hey, this has been a fantastic show. Again, very helpful. As we wrap up, do you have any just either final thoughts, or if not, because I don't want to put you on the spot here, but if you have any final thoughts, let me know. Otherwise, I'm just curious how our listeners might be able to connect with you.
Yeah, I mean, I would definitely just encourage everyone to not be afraid to make your voice heard. If there's something that is stopping you from living your full potential, to live your healthiest and best life, like there are organizations, there are advocates, there are people out there who are ready to hear you and ready to have your back. So, make your voice heard, and don't be afraid to speak up for yourself to live a longer and happier life. If anyone wants to keep up on what the American Heart Association is doing in our advocacy space, we do have our grassroots platform, heartpowered.org, HEARTPOWERED.org. And you can keep up to date on all the stuff that we're doing, not only on physical activity, but healthy eating, CPR, medical, access to medical care, the whole thing. And you can keep an eye on what we're doing to affect policy and system change.
Good stuff.
Thanks so much. This has been just an excellent episode. A lot of great insights that you've provided, and I'm sure people are going to have additional questions that they want to find out what American Heart Association is doing. It's a pleasure to have you and American Heart Association strategically partnering with the Medical Fitness Association. All the work that you're doing with the PAA, I think all of these types of things are how we move it forward and how we give people more voices. So thank you so much for being on this episode.
No, thank you for having me. It was fun.
Thanks so much, Greg.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population. an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.